So we're at almost to our last presentation. I often make this comment in this competition that we often have repeats, and Charlie is a repeat. People did not see her in the presentation last year, but she is in the presentation this year. The other interesting thing is that we teach this class that we launched last year called Public Health Entrepreneurship. The goal of that class was, after Innovation in Action, students who were really interested in moving their idea forward and wanted to understand what it took to move an idea forward, they would come into this mini course that we're teaching. What happened to me last year is actually only a third of the Innovation in Action students went onto that course, but 2/3 of the students had never been exposed to Innovation in Action, which was a really interesting thing. And the next team that's coming up, Elizabeth Michelle, actually got so excited about what she learned in the class that she decided to go through the Innovation in Action process. So with that, I'd like you to please welcome to the stage Canopy.
Hello. My name is Brandon Keelan, and along with my partners Ann Dong and Elizabeth Michelle, we are Canopy. This is Andrea. About a month ago, I spent the night in the emergency room with her as she cared for her Uncle Frank. Early in the evening, Frank's blood pressure dropped to dangerously low levels. And in order to keep him stable, doctors had to put in what's called a central line. And this moment, when the doctor turned to Andrea and asked, "Can we put in a central line?" this is the moment that threw her. I stood there and watched as she had her uncle's DNR paperwork in her hand and the doctor's question on her mind, and she said, "I don't know. I'm not sure what he wants." That night, Andrea had to answer the question, but it just as easily could have been anyone in this room. And so my question to all of you now is, would you know what to do? Our product, Canopy, facilitates the end-of-life conversations that we aren't having but maybe should be. It's a simple web app that allows users to find the answers they might need someday. We take people through the process one step at a time, using plain language, not legalese. We follow a model similar to TurboTax that takes a really complex topic and breaks it down into really manageable pieces. At the end of the process, users walk away with a signed Advanced Care Directive, a legal document that contains their wishes that they can share with loved ones and medical providers. In addition to the legal document, we allow them to record in their own stories what they want. We save progress automatically so that people can work at their own pace. And we balance the complexities of modern medicine with the realities of the human condition. Topics we cover range from specifics about CPR to the people and things that are most important in life. And at the end, we take the Advanced Care Directive that was created and we break it down, showing users how their answers informed the document.
So our target audience includes everyone, but the people who need it most are those that are 55 and older and have seen firsthand the complications that come with modern medicine. In addition to traditional marketing, we plan on distributing our product by partnering with organizations such as insurance firms and other benefit organizations who have a vested interest in reducing unnecessary medical spending. Studies have shown that by having these conversations, you can reduce the cost of end-of-life care in half. Our product costs $50. Currently, if you're to go and file a living will, it costs you $400 on average. If you're to go through a law firm, it can cost you well over $1,000. So we believe that this price point is pretty reasonable. But we believe that everyone should have this conversation. And so we realize that there are still individuals who are not part of this conversation. And we as a company believe in health equity and believe that everyone should have access to this conversation. So in order to do that, we will provide promotional codes to individuals who qualify for existing income-based programs so that they can use Canopy for free. Even with this promotion, Canopy can still make significant profits. This tool is only used once, But as more and more individuals enter retirement age, the need for this conversation only grows. In year 5, there will be 71 million individuals who will be older than 55 and that won't have an advanced care directive. Conservatively, we believe that we can target at least 5% of the market, if not more, generating over $70 million in profits. Our competitors have a lot of key gaps. Existing digital tools lack the user experience. In cases like LegalZoom and Everplan, they don't tackle these questions holistically. With printed materials like My Gift of Grace or Missing Pieces Plan, they don't offer the formal documentation needed. And nobody offers these conversations, nobody allows individuals and their loved ones to record their wishes through video. Canopy looks at this conversation holistically and provides users with the best possible experience.
We didn't develop this tool on our own. Our tool is a reflection of the conversations that we've had with experts. Our first group of experts include individuals from the fields of law, medicine, and public health. And they told us of the immense lack of tools to help individuals better manage conversations about the end of life. Our second group of experts include our potential users. We launched a survey in which we received over 200 responses, where people talked to us about their needs and about the tools that they might use. Half of our respondents currently or can see themselves becoming a primary caregiver for a loved one. Yet if they had to make a decision today about end of life, they would not know where to start. And 74% of our respondents told us that they would use a digital tool to help them better manage end-of-life healthcare decisions. So we are providing that tool. In our first year, we're focusing on developing our product and piloting, validating our tool with our users as we develop our relationships. And by our third year, we are making our tool available for sale. And by year 5, we see ourselves marketing on a national level. We believe we have the right tool and the right team to make this tool a reality. And she brings us technology and strategy expertise, while Brandon uses his understanding of design methodology to elevate the user experience. I use my background in behavior science and policy to ensure that this product is grounded in human reality. So we ask you to invest in us. Join us as we leverage the power of this multidisciplinary team, and partner with us as we create a tool that is affordable and accessible for all, so that people like Andrea have the tools they need today to better manage the difficulties of tomorrow. Thank you.
Yes, I echo all of that. Excellent, excellent presentation, especially for hard to go last. I hope that I'm not going to say something that I'm not supposed to share, but I think it's important to tell you that there's a lot of deliberation between the two groups of judges that only saw 8 groups each, and then had to figure out together who the 5 would be, right? So half of us didn't see the other half. There was a very clear message. We were the side that did not see you all, and there was a very clear message from our cohorts on the other side that they wanted to encourage us not to worry about, they didn't want to tell us much about you in advance because they knew that we would find your presentation so compelling. So I just wanted to give you that insight feedback. I hope I'm not in trouble by Ann and don't get invited back. But that's amazing. I wanted to ask about, so total addressable market seems large. It seems reasonable to me that 5% of that market would be amazing, and potentially even that you have the ability to capture that. What I'm not clear is what your costs are. So therefore, what does break even or profitability look like for your company? So I heard you talk about There we go. Okay, thank you.
So our costs include employees. At the initial stages, that's pretty low, but as we grow, we'll need sales and marketing to kind of reach more people and get this product out into the market. Development, obviously, as we grow. And then we have some third-party services. Obviously, as a web app, we have hosting and digital requirements, including security, and then accounting, legal, and insurance considerations. They're all things we factored in.
So I have, just if you bear with me, a couple questions. So part of the story here is access, right? Mm-hmm. That Andrea didn't have access to the information that she needed, nor was it well, no, a DNR had been sort of created, but just wasn't specific enough and also wasn't accessible. But part of the argument for the patient or the customer signing up, I guess, is a little bit based on cost, right? $50 versus $400 or $1,000. Is that? I wonder if that's really going to drive utilization of your service. Isn't it true that a lot of people don't specifically create living wills or DNRs or because they really just don't sort of want to deal with it, and then they get older and it gets lost in the shuffle? Could you respond to that? And could you do anything to actually not just create a more easily accessible record, but increase the adherence of it? Because on the money side, the benefits of it accrue to the payer. Ultimately, Medicare would benefit if somebody had a more receptive and didn't go through a very expensive treatment rate at the end of the care. The consumer's paying the $50, but the insurer's benefiting at the end of the day. So, sorry, there were 3 or 4 things embedded in there, but the one I really would like you to address is this really going to stimulate more people to take this on?
Yep.
Part of our company is in building relationships. So as we build relationships with organizations such as AARP or with hospital providers and doctors who can be our champions, these are the people who are having conversations about end of life. And they will not just be able to have the conversation, but then bring a tool, an option for their members or their patients to use. And another part is talking about the community. There are things such as community health workers who are already working with individuals who are living in marginalized populations. So as we tap into those resources, such as the income-based programs that we talked about, community health workers and other advocates will be able to champion this tool with their customers so that we are able to get someone who is using this product and who can understand the benefits of such a tool.
And one of the things that I think we are looking to kind of improve about the existing options is really bringing a high level of user experience. We glossed over it, but there's one of our competitors is a game called My Gift of Grace, and it's a simple card game. But they've done a number of studies on the game and participation in it, and gamifying and kind of bringing this element of interaction to the conversation has increased the rates substantially in people who have then kind of gone on to create a living document or legal will. And so one of the things we're trying to do is collect the best of all worlds. So some of the frameworks about the specifics of medical care that you need to be able to know and understand for the end of life, as well as some of the aspects of user experience that we're seeing kind of slowly bubble up to the surface digitally across all tools, but in this market even, to bring them together and kind of provide a better experience overall to start these conversations. One of the other things that we've talked a lot about is how to tap into people at the moment when they're already kind of thinking about this problem or have had an experience that might lead them to be on and in mind that this is something important. So our target audience is those who are 55 and older and maybe aren't themselves in a frail state or nearing death, but have seen a loved one, a father, aunt, uncle, whatever, gone through a really complex medical procedure and had some sort of complication. We really think that we're in an age where that's suddenly become much greater conversation as we have new advances in medical technology that make it easy to live a long life, but maybe not a good one.
So two question for you. So this actually hits very close to home for me. I received a phone call within the last 6 months that said, my mother had passed and said, did she want to donate her organs? Mm-hmm. And honestly, I didn't know. We never had that conversation. So I think you've got a really important and interesting idea here. How much do you plan to get to $70 million profit, which I wrote down because that's a very interesting point, is how much do you need to be able to have this be an aid at the point of care versus just something that families do in a new medium to have that very difficult conversation?
So we've talked a little bit about where we think the target is, and we're right now focused a little bit on kind of having a conversation in advance. It's one of the things that we think improves the overall experience of someone's end-of-life care, because if you're at the moment where you need this, it's a crazy situation anyway. But we have talked to a lot of physicians, clinicians, and people who work in social work in the hospital, and they've also expressed a desire to have something that allows them to facilitate these conversations in situations where maybe a trained social worker and this conversation doesn't exist. We just, at this point, we did a pretty substantial pivot about a month ago from a different problem we were working on. And at this point, think that this is the most viable option, but we're definitely open to exploring kind of how to interact with people at the moment of care in the end.
Go ahead.
So just another quick question. By the way, well done, great product. I encourage you to accelerate it so I can become a customer and maybe even an investor. So that being said, so I'm fixated on the 70 million by year 5 as well. What is your cost of acquisition? Do you know that ballpark?
No. We've estimated about 30% of the cost for each individual for marketing and sales. So that's our working number, but don't have kind of a fully tested, baked number for you. But that's what we have, 30% of sales.
Sorry.
Are we done?
This is a hard group triangle. Thank you, Canopy. I said it.